Today I'm going to be talking to you about Benner's theory. So Dr. Benner, she was born in Hampton, Virginia. She earned her bachelor's degree of nursing from Tasmania College in 1964. She then earned her master's from the University of California in San Francisco, and then finally she earned her PhD from Berkeley. So in the 1960s, she worked as a research assistant at the University of California. She was on a project that was worked on achieving methods of interprofessional consensus, assessment, and evaluation, which further led to her theory. And then in 1982, she began working in research and teaching at the University of California in San Francisco. So she is most popular for her book you can see to the right, Novice to Expert, which is the theory I'm going to be talking to you about today. She has also published 9 books, including this one, and many other articles. In 2011, she was named a living legend by the American Academy of Nursing for notable contributions of nursing practice and research and education, and she is still currently a professor at the University of California in San Francisco. So how Benner defines person, health, nursing, and environment. She describes nursing as a developing practice that focuses on providing accurate care. She emphasizes that nursing is not just technical skills, but one's ability to think critically and connect with patients. She thinks health is a personal experience, and each person can have their own views on what health means to them. Environment. Benner believes that environment includes physical, social, and cultural factors that affect health. And finally, Benner believes that the person is the individual receiving care. She believes that every nurse must understand their patient's physical, emotional, and spiritual needs to provide the care they deserve. So the theory I'm going to be talking to you today about is Benner's theory, known as Novice to Expert. This concept explains that nurses develop skills and understanding of patient care over time from a combination of educational foundation and personal experience. There are 5 clinical competence within her theory, from novice, advanced, beginner, competent, proficient, and expert. Each stage represents a progression in nursing skill and knowledge gained throughout experience, with the idea that expertise develops over time and through practice. And you can see an example of this, of what her theory stands for to the left. And overall, it just means when you're a new nurse, you have a lot to learn, and you're mainly following things by the book and by rules, and as you grow older you gain a more holistic view of nursing, which I'll talk to more to you in the next slide. So as I previously talked to you, these are the 5 stages of her theory. So a novice nurse is a beginner nurse with no experience, and they generally follows the rules of nursing to help them perform tasks. An advanced beginner shows pretty good performance and has prior experience to nursing situations, and is able to recognize reoccurring meaningful components that allow them to guide their own actions. Next, you have a competent nurse, and this is a nurse who has experience of 2 to 3 years. They are now aware of long-term goals, and they can gain perspective when planning their own actions that help them achieve greater efficiency and organization. Then, almost lastly, you have a proficient nurse, and this nurse perceives and understands situation as a whole. They have a more holistic belief of nursing and decision making. And then finally, you have an expert nurse, and this nurse no longer relies on principles, and they have a deeper experience and an intuitive grasp of clinical situations. So I'm just going to briefly talk about this slide because I talked about it in the last one a lot. So a novice nurse needs to focus on mastering their basic nursing skills. An advanced beginner nurse needs to continue to build their confidence by taking on more complex tasks. A competent nurse needs to focus on their ability to prioritize tasks, manage time. A proficient nurse needs to challenge themselves in leadership roles, and an expert nurse needs to focus on mentoring less experienced nurses. So Benner's theory really talks about the changes nurses have when they are a beginner nurse all the way until when they're an expert nurse, and she also emphasized throughout her theory that the best nurse is the nurse who can provide the best care to her patients. So how Benner's theory relates to nursing practice and patient care. It relates to patient care because it helps optimize patient care by guiding nurses through stages of skill development. The theory allows experienced nurses to support their colleagues, ensuring that each patient receives the care from the nurse that is best suited for their needs. So a more experienced nurse gets a more complex patient, while a less experienced nurse may get the more stable patient. This theory also applies to nursing practice because it provides a framework to guide nurses' development as they gain more experience, allowing for tailored education and mentorship. And the theory allows to assess nurses' skills, to allow the healthcare organization to effectively assess and support their nurses in different career points. So, an example of this nursing theory being used in a study. So, the study was created to predict how novice nurses trust their ability to care for acute situations. The participants were asked to complete the study based on their own trust and ability to make clinical decisions. You can see that to the right. And the results showed that the two most predictors that related to the trust and ability to provide care were the duration of work experience and participation in acute situations. This directly relates to Benner's theory because within her model, Novice to Expert, she highlights the importance of being an expert nurse is experience to develop the performance in clinical nursing. So how this theory can be applied to clinical practice, I sort of talked about this previously, but a nursing supervisor may do shift assignments based on nurses' stages of skill acquisition. So a novice nurse gets a more stable patient, where an expert nurse gets a more critical patient. As well as it allows for nurses to get the support they need. Benner's model highlights the importance of practical experience, which has encouraged integration of mentorship programs in the healthcare settings, where experienced nurses guide less experienced colleagues throughout complex clinical situations. So, what led to the development of Benner's theory? One of the key influences to Benner's theory was the adaptation of Dufresne's model skill and acquisition, which discusses how people develop skills through experience, which she outlines in her theory through the stages of skills of acquisition from novice to expert. Benner took this model and applied it to nursing, drawing her own extensive practice and research to understand the profession of nursing competence developed throughout experience. She conducted extensive research across many different clinical settings, observing nurses and how they act, in which she discovered the importance of real-world clinical situation in shaping nursing expertise. Her theory can now be seen in the book I talked about previously, Novice to Expert. So Benner's contribution and impact on education has been extremely significant, not only her being a professor, but as well as her theory directly applies to education. She has created a model that provides structured progression and a clear pathway for nurses to develop their skills from a novice nurse to an expert nurse. She exemplifies the importance of clinical experience in education in order for these nurses to gain a deeper understanding. She highlights different learning strategies based on students' experience level, allowing for tailored instruction, and she has helped education understand the different stages of clinical competence and how to effectively support their students' progression. Thanks for listening, and I hope you learned something about Benner's theory, and I'm excited to apply it to my own research question in the future.